Hi, this is Robert Slayton, author of the Healthcare Manifesto. People have asked me, well, why the Healthcare Manifesto? Why that name? What happened to come up with it? And the answer is, I got really frustrated as a broker of employer group health insurance and wrote a 2-page manifesto about what's wrong with the system and what we can do to make it better. And from there, the book took shape around that. And so my Healthcare Manifesto turned into the Healthcare Manifesto. And what I'd like to do is I'm just going to read it to you from my book. And so if you agree with it, shoot me an email at breakthecycle@robertslayton.com, or go out, grab a copy, and let me know how I can help you. So with no further ado, here's the excerpt from the book. So, strong words from a formerly frustrated broker. The time has come to wake up and realize that giving a person a health insurance card and thinking that it's enough is a thing of the past. The time has come to wake up and realize that as an employer, you do not have to suffer the pain of unsustainable renewals of your health insurance plan. Offering health insurance is not enough anymore. Employers need to do more. Assuming an insurance company will take care of your employees is a fiction that can no longer be tolerated. Ceding power to both the insurance company and the healthcare providers leads to higher costs, higher premiums, and poorer outcomes. We as employees need to do better. We as employers need to do better. Employers need to take more proactive approach, one where we say enough is enough. Or as character Howard Beale in the classic movie Network stated, I'm mad as hell and I'm not going to take it anymore. We don't have to submit to zero control over health insurance premiums. We don't have to submit to poor care, expensive medications that may not work, nor to no transparency of the cost. We don't have to continue. Why do we as patients use the hope and pray model of care? We hope that our doctor made the correct diagnosis. We pray that he's given us the best doctors, specialists, surgeons. We pray that the treatment works. Right now, we can gain control over costs for both premiums and health care. Right now, we can gain control over the quality of care, thereby driving better outcomes. Right now, people are waiting to help guide us as patients through the complicated healthcare maze of diagnosis and treatment. Data is available today such that we can confirm that we have the right diagnosis, which leads to the right treatment by the right doctor at the right facility for the right price. What happens when we do this? Costs go down, quality goes up. We can be a hero to employees because instead of raising employees' premiums, we lower them. We can also be a hero to employees because instead of raising the employees' deductibles and out-of-pocket maximums, we lower them. We can even help an employee get the expensive surgery they need at no cost to the employee and still save money for the employer. Say no to unsustainable rate increases. We can be a hero to the bottom line and board of directors because we can take control of the health care and health insurance spend. Once that's achieved, we'd be the only people who can control that an uncontrollable expense. Gone are the days when the insurance agent gives you a 10 to 20% rate increase, then negotiates it down to 8% saying it's under trend. These are fictions caused by ceding control to a person who makes more money the higher your premiums climb, and insurance companies who design plans to make a profit. Now, who does this new program work for? It doesn't work for employers who do not contribute to the cost of their employees' insurance. This does not work for employers who contribute a flat dollar amount towards their employees' insurance. The reason is that there are no cost savings for the employer, which can be shared between the employer and the employees. This plan does work for employees that contribute a significant amount to the cost of coverage, at least 50 or 70% or more. Our philosophy is that both the employer and employee share in the benefits of this new order. This plan does work for companies willing to champion the new model as it gets implemented. Typically takes 3 to 5 years to go from point A to point C. And there are lots of many things along the way. You're going to save money in the first years, but to get to full implementation takes time and it takes effort because it's a re-education on how everything works. People are dying because the old hope and pray model. It doesn't have to be this way. If you had enough of this hope and pray model, hoping your annual health insurance renewal won't be too bad, and if you're fed up with hoping that the employees are diagnosed correctly and praying that you have the right treatment plan, then please join me. Join me in the next generation revolution. Better care, better outcomes, lower cost. Let's break the cycle of mediocrity together. Find out how by emailing me at breakthecycle@robertslayton.com. Thank you very much for your time.